This dentist surrendered after two of her patients died following hair transplant procedures she carried out on them. The patients, both engineers, died within hours of undergoing surgery performed by Dr. Anushka Tiwari at her clinic Empire in Uttar Pradesh's Kanpur. According to the national guidelines, a registered dermatologist or a plastic surgeon with required certification can perform hair transplant procedures.
So when you go for consultation in a clinic, you are told that your surgery will be done by XY surgeon. But when you arrive, you realize that XY surgeon is nowhere to be seen and your surgery will be done by some unqualified staff. Now this is a perfect setup for any kind of complication to happen. So hair transplant surgery should be done in a hospital setup with a well-equipped OT and emergency facilities. In case you opt for a daycare clinic, which is also fine, you should make sure that the clinic is associated with a tertiary care center nearby with a ICU facility. A patient should be examined by a physician or an anesthetist and a clearance should be given by them to the patient before the surgery. Proper blood workup should be done and allergy sensitivity tests to certain drugs which will be used in the surgery should be done.
As per Bhaskar English, Dr. Tiwari never presented any certification in hair transplant surgeries. Vineet Dubey, one of the deceased, had his surgery on 13th March and died on 15th March at a different hospital. An initial investigation found that standard pre-operative steps were not carried out in Vineet's case. His health issues were allegedly overlooked and no tests were done before the procedure. Doctors later said he got a bacterial infection leading to his death. Another case emerged involving Mayank Katiyar, who underwent a hair transplant at the same clinic on 18th November 2024. He died the next day. Their families lodged complaints against the clinic citing medical negligence. They said that the patients were given local anesthesia and were left unattended for long periods. They also added that the patients were not informed about the possible side effects or risks involved in the procedure. In India, a doctor performing surgery without proper certification can face up to 7 years in prison, a fine, or both, along with possible cancellation of their medical license.